This is one of the excellent newer model of conference which has been devised by Shushrut. It's beautiful. We had all the live surgeries yesterday and 16 live surgeries with the case discussion. So I feel this is one of the unique way in which he has done this. And I would feel probably this is the one which may be a path breaker.
Very well organized and well structured course, I must say. It's a little different from the usual conferences that we have. All the case-based discussions of one case where the surgeon highlights the difficulties he faced and takes feedback, and there's a lot of discussion. So I feel the take-home for most delegates will be great because all of us are into troubles during surgeries, and we can learn a lot from the experiences of how he overcame the difficulties during the surgery. So yes, conference with a difference, definitely.
Here there were live surgeries, cadaveric surgeries also as a training course, and also case discussion, where every case was discussed threadbare. In addition to that, we had workshops also on various newer technologies. So this has overall it has been a very new concept, and it has been appreciated very well by the most of the delegates attending.
So, Nagpur was a very pleasant surprise coming out here. The city is well established and well known, easy to access. The organizers put together a faculty which was pretty much the who's who of trauma management in India itself. We had a very interesting bunch of delegates who were very interested. This conference had a mixture of everything. There were talks, there were discussions, there was hands-on workshops. There were some new instruments which have been introduced, new implants which have been introduced. So overall, a very, very heady mixture. And the best thing is the varying level of experience which the faculty brought in, and also the varying level of the delegates, because of which the discussion went from being a very simplistic kind of a discussion on cases to some very, very complex cases being discussed. In all, I would say this will become a very important landmark for the management of trauma and teaching people how to manage the trauma appropriately.
Hands-on and everything was very interactive. That took us on a very good level.
Even the resources in the lab.
Yeah. So everyone was very happy about it. So they got to learn a lot of new things. We also got to learn a lot of new things.
And the difference has come in not only because of the live surgeries, which is seen many congresses, but the fact that each one of the talks given by surgeons of repute is one case. So that brings in a lot of discussion, which is the heart of any academic interaction. A didactic lecture may be good, but most of the times it then becomes an eminence-based evidence. What we are bringing here is somebody of eminence speaking, but lots of people in the crowd discussing what should have been done, what should have not been done, and how things could have been changed. So that's the key point we've had in this meeting.
Very evolving, things keep changing year on year. So I can safely say whatever we saw today, some of them might not be there next year when you come back to the same course. So orthopedic surgery is changing and trauma surgery is changing on a rapid basis. So keep updated with the times, keep attending more such conferences where we can get to see the latest advancements and refine the treatment that we give to our patients.
So being an informative and an academic treat for beginners like us, this seems to be a good platform for us to demonstrate our work, whatever we have done in our professional life, as well as learn from the mentors what they have done. So hats off for them, and thanks for organizing this event.